Hello viewers, I am Dr. Chandra Sekhar, Orthopedic Consultant in Care Hospital, Banjara Hills, Hyderabad. Today we will know a few details about how an ACL injury can happen and how to recognize it and what are the various treatment options. So ACL injury is a very common injury. ACL stands for anterior cruciate ligament and it is one of the main ligaments which supports the knee joint. So usually ACL injury happens as a sporting injury. So whenever the patient jumps and lands down in an awkward position and twists the knee, the ACL it's called as a pivoting force. So when there is a pivoting force, the ACL stretches out and then it tends to rupture. Most of the time the patient will hear a pop when the patient lands and then twists the knee awkwardly, and he will also notice an immediate swelling around the knee joint. So the patient will have significant difficulty in walking once the injury happens, and it's important to see a clinician as soon as possible. So a clinical assessment of the knee would show a lot of swelling around the knee joint and a sense of instability. So in an acute setting, it's sometimes very difficult to identify an ACL rupture. However, the ACL rupture can lead to laxity around the knee joint, and there are a few tests done clinically to assess the integrity of the anterior cruciate ligament. The other investigations which are necessary to identify an ACL injury are a plain X-ray of the knee to see if there is any bony avulsion and if there is any translation of the bone instability, and the most important is a MRI scan of the knee. It is confirmatory and diagnostic if the ACL is completely torn or not. So the initial line of treatment for somebody who has an ACL injury is to splint the knee, take rest, apply ice packs and take anti-inflammatory medications, and once the pain allows, the patient needs to start on a physiotherapy regimen. Depending on the age of the patient and the other requirements, the ACL injury can be dealt with either in a conservative manner or in an operative fashion. Most of the time, if the ACL injury happens in a young athlete with significant functional demands, then the preferred line of treatment is to go for an operative intervention. And the surgery usually involves an arthroscopic reconstruction of the anterior cruciate ligament, though there are very rare occasions where the surgeon may contemplate a repair of the ligament. But most often than not, it is usually a reconstruction where the torn ACL can be trimmed off and the ligaments which are there around the knee joint can be used as a supplement to reconstruct this particular ligament, and usually it is done by arthroscopic methods. The other way of dealing with ACL injury is by physiotherapy and rehabilitation. It is generally recommended for low demand patients and in elderly patients who have already developed some arthritis in the knee joint, where ACL injury can still be managed conservatively with hamstring strengthening exercises. Having said that, the main purpose of the reconstructive surgery is to give stability to the knee joint and in the long run to prevent any degenerative arthritis. And most often the ACL injury can be associated with meniscal tears as well. So an MRI scan will identify before the surgery if there is a meniscal tear, in which case the patient can undergo an ACL reconstructive surgery along with a meniscal repair surgery. And usually the results of meniscal repair are much better when it is undertaken simultaneously along with an anterior cruciate ligament surgery. And usually this surgery is done once the knee is a little bit silent. That means the swelling has subsided and the patient has achieved adequate range of motion, and the preferred timing of the surgery is about 4 to 6 weeks following the injury. And all in all, the success rate of ACL surgery is quite high, and the satisfaction levels are also good following the surgery. Thank you.